Hi, I'm Dr. Claudia Kim. I'm cosmetic surgeon here at New Look New Life. Today we're going to talk about the BBL laser. So not the Brazilian butt lift, that'll be in another video. This is for the non-invasive laser or laser modality that we use to address facial concerns. And the reason why I put them in quotation marks, because it's technically not a laser. It is using a broad spectrum of light versus a single wavelength in a laser. But we'll refer to it interchangeably because patients really don't know the difference between what is a laser and what is not a laser. But hopefully this video will help you guys understand the certain targets for different lasers and the recovery and the expectations and maintenance as well. So BroadBand Light, or BBL, the system that we use is from Cyton, and it's helped to address sun damage such as freckles or sunspots, fine lines, the appearance of scars or active acne, and to help improve the appearance or the texture of the skin. I have talked about the Halo Pro in another video where it is a little bit more invasive than the BBL, and the more invasive something is, the more stronger it is or the more effective it is in addressing concerns. But there is a lot of overlap between the lasers, and sometimes your provider might recommend using a combination of the different types of lasers based on your concerns. The BBL is excellent again for sun damage such as the sunspots or age spots or the freckles, melasma, which we can see flare up in some individuals either through hormonal changes or the seasonal changes. It helps with rosacea or the redness that people experience, fine lines, and maybe just some overall dullness to the skin. What patients will experience during the BBL laser is that it really does feel like a rubber band kind of snapping against your skin. And the BBL is typically not done with a topical lidocaine, as in the stronger lasers. It is just annoying. It's not pain-free, but definitely tolerable. Within the BBL umbrella, there are different types of lasers that are meant to address different things. And it's just using a different type of light to address those concerns. So you have your BBL Forever Young, and that's going to help you with the hyperpigmentation and the texture and the appearance of the skin. The BBL Forever Clear is helpful for addressing active acne or acne scars. Finally, the BBL skin type can help to stimulate collagen to assist in tightening up the skin to a mild degree. The BBL procedure, or the laser, can take anywhere from about 30 minutes to an hour depending on how large of a space that you want to address. If you're addressing just some specific concerns such as like the veins, it might be much faster. If you're treating your whole face, it can take about 30 minutes. Again, if you're addressing the neck or the décolletage, that can also be a little bit longer. You can also use the BBL function to address the concerns on, let's say, the speckles or the sunspots on your arms, on your body. So it really is a customizable procedure. Who is a good candidate for the BBL? The Fitzpatrick Skin Scale is a scale that we use to assess the skin type of the patient, and that scale goes from 1 to 6. So for comparison, I am a Fitzpatrick skin type 4, which means that I tan before I burn, and so the darker melanated patients are going to be categorized as the 4, 5, 6. The patients with the fairer complexity, which is 1, 2, 3, these are the individuals that tend to burn first. Can tan after they burn, but you'll generally see the burning first. And what does this mean when it comes to lasers, and why do we assess this? This tells us that you have a tendency to have more melanin production, right? So melanin is the skin cells that are responsible for forming pigment. And when you do a type of laser, it produces inflammation and can potentially have post-inflammatory hyperpigmentation, so that the laser causing the inflammation have stimulation of the melanin cells to actually cause hyperpigmentation, meaning that the areas get darker after a laser. So in individuals that are considering the laser, you do have to have a very clear and concise conversation with the treatment provider, so that if you are considering this laser, they may start you on a topical prescription cream called hydroquinone. And this cream helps to calm down those melanocytes, those cells that cause pigment, so that when you do the laser, it doesn't have that hyperpigmentation effect. And so make sure that you are a candidate, and if they don't assess it, then please be aware that this is something that can happen. So make sure you do have a facial analysis with your provider before doing or considering any type of laser. So the individuals that would be good candidates for the BBL would be ideally Fitzpatrick 1, 2, 3, 4s potentially with pre-treatment, and potentially 5 on a very low setting. What to expect after the BBL? So during the procedure, remember, it feels like a little rubber band snapping against your skin. After the laser is done, you shouldn't feel anything, maybe a little bit of warmth for a few minutes after the laser. And then the initial darkening of these spots, which is different from the post-inflammatory hyperpigmentation, but you will see some darkening of the sunspots that start to fade and eventually go away after 7 days. Now, some stubborn spots, like the sunspots on your face that are larger and darker, you may need additional BBL sessions. And so expect to do a series of these treatments depending on your concerns. I like to say the first BBL treatment may remove up to 50% of the pigment of, let's say, the sunspots or the vascularities or the rosacea. And each subsequent laser treatment is going to remove more and more of that pigment. Depending on your concerns, you may be expected to do a series of these treatments about 4 to 6 weeks in between. And now let's say after the initial series of treatments, you're at a place where you're happy with the appearance of your sunspots, your rosacea, your melasma, then you will go into the maintenance phase. So that would be about every 3 months. Obviously, you do have to wear sunscreen and you do have to maintain these results. So kind of minimizing your exposure to the sun, because that extended prolonged sun exposure can cause the sunspots to come back faster. Other things to note about your skincare routine: oral retinoids such as Accutane need to be stopped 6 months prior to the BBL. If it's a topical retinol like tretinoin, you do have to stop using it 2 weeks before. You can resume it 1 week after the BBL. Other things to prepare with is a gentle facial cleanser like Cetaphil or CeraVe, and a gentle sensitive skin lotion or moisturizer, which you can apply right after. And very importantly, to make sure you are wearing a type of sunscreen or SPF. Mineral SPF is ideal. You should actually be wearing SPF all the time, even if you're not doing the laser, but it's especially important during the post BBL. So I usually always do my BBL and halo to maintain my youthful appearance and the glow of my skin. So I'm sharing my little secret with you guys. Please follow if you like my videos, and stay tuned for more content.